Hi, I'm Dr. Craig Dalton, Coordinator of Flu Tracking. I'd just like to share with you today some interesting findings we've had with flu tracking. As you know, we've been tracking flu for about 13 years now, but because of the COVID pandemic, we thought it was really important that we focus on symptoms of COVID and really track and start tracking early in the year, earlier than the usual winter tracking that we do. So this is our usual time series of data that we see. We get cough and fever starting in May. It heads up, peaks around July, August, and then goes down again. But this year, we've started earlier. And we started back here in February, and you can see that we had pretty typical cough and fever rates early on, but then this dropped, and then it dropped dramatically round about here where the red arrow is, and that was when social distancing really started to kick in Australia, with the cancellation of large gatherings and restrictions on a lot of venues that are very social and where people are mixing. And then as the social distance interventions were increased and there was less gathering of people, the cough and fever rates have dropped down even further till now they're really at historically low levels. And what this suggests is that the social distancing is working. It's affecting all causes of cough and fever. So there are many respiratory viruses like influenza, parainfluenza, RSV. This means that it's actually decreasing the rates of all infections, all respiratory infections in the community, and with that we hope it's going to decrease the rate of COVID as well. Now, of course, COVID is very infectious, and we shouldn't relax just with seeing some good results with flu tracking at this point. We need to continue that important social distancing because this can bounce right back up again if we relax it at this point. But so far, really important and reassuring findings.